As students head back to school and many find themselves participating in sports, no one wants it to happen, but injuries definitely can happen.
And joining us now to share the importance of seeking expert care and listening to our athletes and their bodies is UT's Physicians, Pediatric and Sports Medicine Orthopedic Surgeon, Dr. Jessica Traver, along with Nestle Romero, whose daughter recently underwent surgery. Hi, Cassandra. Ladies, welcome to the show. Thanks so much for being here. And Dr. Traver, we're going to get to the specifics here in just a moment, but we wanted to get Nestle and Cassandra's story, really. Mom, when did you know that there was some sort of problem with Cassandra?
So we started playing softball again after, we were allowed to go back to the fields in May. And 3-4 practices in, she started limping when she was running. And we realized she couldn't stretch out her hamstring. And, and she would tough it out. And she's like, no, I'm fine. It was just the running. But we ended up taking her to see the UT physicians and try to get an MRI and what wasn't straight. So Dr. Traver helped us and we got it figured out and found out we had to do surgery and stop playing softball for some time.
And I know that, Cassandra, you're described as a 7-year-old softball enthusiast. You look very enthusiastic there with your bright smile. Nestle, for any parent knowing that your child has an injury like a meniscus tear, I mean, that's a really big deal. And I'm sure a lot of people are concerned that that could have lifelong effects. But Dr. Traver, it is not something that is insurmountable, right? We can correct this problem.
Right. So I think, as Nestle mentioned, that there's a couple things about Cassandra's specific meniscus tear that are a little bit unusual. So she was born with a discoid meniscus, which is essentially an abnormally shaped meniscus. Usually the meniscus is a piece of cartilage that sits in between the femur and the tibia or the shin bone, and it acts as a shock absorber to kind of disperse the forces working on that joint. But Cassandra, instead of having a C-shaped meniscus, was born with sort of a hockey puck or almost a sausage patty amount of discoid meniscus tissue. And so that tissue tends to be prone to tearing and just being injured by even little things. Like in Cassandra's case, she didn't even have a big injury necessarily. It was just, she was a little bit sore after playing in her softball game one day. And so now with our technology, we're able to do things with surgery to kind of decrease the long-term effects, whether it's a regular meniscus tear or a discoid like Cassandra's.
And Dr. Traver, Cassandra's 7 years old, and so I think even as a mom myself, if my boys are having a long practice or something, they wake up, oh, I'm sore, maybe we kind of think it's, oh, growing pains, or yeah, you worked out a little bit harder today. So, but a parent or a mother's intuition, I guess I should say, you should trust it, because that's sort of where we get this, or that moment of, we got to make a call. Somebody needs to look at this.
Right. No, I think that that's a great point, is because nobody knows your child better than you do. And so I think that there are a couple sort of red flags or more concerning types of symptoms to look out for that should clue you in when you should seek medical care. And so in the case of Cassandra, as Nestle mentioned, that she kind of came off the field and was limping, and not just being for a period of 20 minutes or 30 minutes because she worked a little extra hard, but even into the next day. In fact, when I saw her in clinic 2 weeks after her injury, she couldn't straighten her knee out all the way, which is something we worked really hard on post-operatively in a rehab period. So I think limping that continues for a couple days, lacking full range of motion, or in any child situation in which they have pain that really they don't want to get back to playing their sports, that's not normal for most kids. So anything with those type of symptoms should really warn you and warrant you to seek more specialized medical advice.
And Dr. Traver, right now, as we turn back to Nestle and Cassandra, I do want to point out that you do have this special gift for caring for female athletes. You are quite accomplished when it comes to playing soccer. In fact, you were inducted into the Hall of Fame in college. So given your background as a competitive athlete, it seems like you found the perfect career path.
It's true. I grew up in Houston, actually. I played soccer at a club team in the city and played Division I soccer at Tulane University in New Orleans, and my team was inducted into the Hall of Fame. So I just think that there are a couple things that I was born to do, and one of them is definitely taking care of female athletes like Cassandra. I think doing specialized training in both pediatric, orthopedic surgery, and sports medicine has really given me the tools to be able to give her really elite level care and get her back onto the softball field as quickly as possible.
And quite honestly, have a long, lengthy career just like you did as well. And Nestle and Cassandra, how you feeling today? How's practice looking for you?
Good.
It was important for us to get Cassie back to softball because she has an important tryout this week. So it was good that we were able to give her a shorter rehab period and get her back out on the field.
Okay, well, that is fantastic news. Good luck with that, Cassandra and Nestle. Dr. Traver, thanks so much for your time. Sorry we got to leave it there, but in the meantime, if our viewers would like more information, you can visit utphysicians.com or call 888-488-3627.
And we'll be right back.